Hello, I'm Yossi Abraham, and welcome to Zappix CX Tech Talks. This is a conversation about the intersection of AI and customer and patient experience. Today, my guest is Sherri Dorfman. Sherri helps companies tell a differentiated story, marketing story to customers, partners, investors. She has launched her consulting company about 20 years ago and is helping health tech companies of all sizes. She typically works with the management, product, and marketing teams on strategies and planning. Her work is driven by insights that she is gathered throughout the years and currently still gathering, and translate them into spotlights for needs and map them into solutions. Welcome, Sherri.
Thanks so much for having me.
So let's start by you just sharing a bit about your background and experience.
Okay. So since starting my company, Stepping Stone Partners, I've been advising health tech companies and healthcare organizations on supporting patients really at every step of their journey with personalized education, decision support tools, community. I help companies view their solution from the patient's perspective, outside in. I help them also think about it from a whole patient perspective and also how the patient can be supported when they're away from the health system. I think that's very important. I have a deep data-driven background and really believe that there's need to stay connected with the patient um, at all times. And I help companies think about the information that they can gather to be able to support those decisions. It may be information about labs or symptoms or social determinants of health to really support the patient in their journey.
Perfect. We're going to speak a lot about technology, automation, and AI. So I want to start with AI for a second, but if you had to explain what is AI to your mother or grandmother, how would you do it?
It's funny because I actually had to do this to my mother. And when I think back to how I've explained AI to her, I told her that it was really like a virtual assistant on her computer or on her phone, and that it really helps the user access information, understand information, at that it may be around a particular topic that the user is interested in, or it may be around a situation that the user describes. Increasingly, these virtual assistants help the users with specific tasks. And I go on to explain to her and give her examples like rescheduling a doctor's appointment or gathering information from the patient
Yes.
before a surgery, which I think is important. And that really is helpful for the care team. But I also explained that it helps the patient self-serve, that the doctor's office is not always open. And
Yes.
so it really helps the patient gather information to questions that they have when the healthcare system is closed. But I also explained that it can help the doctors as well. They may be recording the doctor's visits, for example, and then it helps them with the after the visit summary. And I explained to her that it also helps them put in follow-up things that they need to do for her, like labs or referrals or some kind of refills. And so I talk about the time savings part so she understands that it's like an assistant.
Okay. Perfect. And talking about you a bit and how are you using AI for your personal experience for now, before we speak about healthcare and the market and so on. How are you using it and how has it grown over the last several years?
Well, I actually started using it for personal things like looking out and summarizing around a particular topic or a destination to plan a trip. So for me personally, it was very simple, but it's gotten more complex personally. So one of the things is around the beginning of this year, I had tests done, lab work, by all different doctors. And one of the things I decided to try with ChatGPT is to put in my gender and age and then ask it to prioritize questions for my upcoming doctor's visit, because I have that once a year in January. And what I expected to see from all these doctors' tests was a list of different tests that were out of range.
Yeah.
And then I would be able to have that discussion with my doctor. But instead, what I saw is a list of my strengths and areas of primary concern. The concerns were by health issue. And so each health issue had the corresponding labs that were within range and were out of range. So I thought that was very interesting. The reason why this really surprised me is because as a patient, I don't have the skills to be able to connect different lab results to a health issue. I just know that
Right.
this is out of range and I need to talk about that. So I was able to actually, with my primary care doctor, talk to him about these issues around particular health issues. And it really helped me prioritize our discussion. And the actual lab results that supported each health issue helped guide our discussion as well. And I felt like I was more of a participant in my discussion as opposed to you tell me what this means. And so it really helped me with that.
A much more educated patient going into the doctor's appointment.
Absolutely.
So let's zoom out a bit and speak about the healthcare industry today. What are the main challenges that you're seeing working with the different companies you're working with? What are the main challenges that the healthcare providers or the healthcare system in general is facing today?
I think that one of the biggest problems they face really are the complexity of patient care as we age. I mean, there's an increase in chronic conditions, and the fact that, and I never really thought about this until the past few months, is that we are all on unique health journeys. And so the providers have got to figure out and track us along and see how we're changing and understand how we're evolving as patients. So I see it as the challenge of uniquely addressing the actual patient's issue. There's also not enough clinical resources, and that's really showing up as that care access problem that many of us face today. I mean, it's been months that we all have to wait for these primary care doctor visits or specialty visits. And I think given the complexity of this patient care as we age, and I think given the limited resources that we have, that I do see another challenge. And that challenge is the care team collecting information about the patient when they're not in front of them. There's just not enough resources to do it. And yet that's the whole picture of what's going on in the patient's care. And as I mentioned, I view the AI as an assistant. So I really see a big opportunity about how that technology can interact with the patient and gather information for the care team.
Yes, I think technology has a lot of potential, but there are still some challenges before you can implement AI into healthcare. What are the things that you are currently viewing as the main challenges for AI to be fully adopted in healthcare?
So I have a blog, Consumer eHealth Engagement, and as part of that, I interview health systems and I ask them about how they're using data and AI for better patient care. And so here's some of the challenges that I hear. One is around the data is siloed in different places.
Exactly.
And so they have systems that are the medical record, the remote patient monitoring, the virtual care. It's just all over the place. And the reason why that's a big challenge is because they can't view the patient's information over time and across care settings to guide their decision. So that's one problem of this fragmented data situation. The second is I don't think that providers truly understand how some of the models are trained. And so as each provider thinks about, is this good for my application, my use case? They have to think about what are the patient populations and how does this fit with mine? So I think a lot more information needs to be provided around the training of the models. And the third thing I would say that I hear is around I think the need to provide transparency to patients. If patients are engaging with an AI bot, let's say, and they're giving information about what their current situation is, and this AI bot is triaging, I think the patient needs a little bit of understanding of why is it sending them to a certain care setting for their appointment? What did they put in about their care? Maybe they didn't tell enough information. So I think transparency to that other very important stakeholder, the patient, is important as well.
Yeah, I agree. And there are additional challenges I see, which is I think the systems, the AI, some of the AI systems are still not ready from a governance point of view and from a security and privacy point of view. and you want to make sure that you have all the different layers of compliance that to make sure that all of this personal information is really secured and protected from the end user's point of view, from the patient's point of view. But on top of that, as you mentioned, I think data is critical. The fact that you need to have the central repository, even if it's not central, if you can collect the data from different repositories, and then how can you make sure that it's unbiased? And how can you make sure that its equity is involved and so on? So there are still multiple layers of challenges, and they will be tackled. I really believe they will be tackled in the coming probably 12 to 36 months, and they will see a lot of advancements in AI and technology continuing to progress the healthcare services here, at least here in the US.
I also hear people talk about AI as like a black box, and that's why I was saying you need transparency. The providers need to see how they can leverage it. The patients need to see how they can understand it. So
Yes,
that's why I think that that kind of transparency is so important going
absolutely.
forward.
And when we are going to implement more and more AI, how do you see us balancing that with the need or the human touch in general of that patient journey?
Well, actually, I think that there are certain tasks that AI does a great job of taking care of, like responding to a patient question with provider approved content. So they could just do that interaction. It's very clear. Or managing a process like automated scheduling. I think that's very clear that the AI can play that role as a team member, by itself, as long as it was set up to do that. But I think there's a need for a human in the loop when you actually have anything care related. It may be a doctor visits with the patient, the interaction is recorded, but as the doctor, he or she needs to make sure that they look at the follow-up notes before it goes to the patient. I don't think that should be automated, as an example. And I think that when you have patients that have emerging needs and there are information going to the doctors, I don't think that should be automated. So many of the remote patient monitoring tools that I actually see escalate to the human based on certain patient responses. So I think that the human expert in the loop can really then make the best care decisions. So anything care related, escalate or have that human in there. Anything that could be automated to go out and grab information for the care team, I think that that's an important team member role.
Absolutely. And I also differentiate between clinical and administrative work typically in that matter. Administrative work, there are a lot of simple tasks like scheduling and collecting information, as you have mentioned, that can really be automated and using advanced technologies to advance. And I completely agree with you about the human in loop on the clinical side. You can still do a lot with AI and machine learning, but you want that personal view, that additional view of an experienced physician or provider that can guide the patients in a more also from a more human touch point of view.
I
Uh,
like the way you divided that out, though, because I do see that as administrative tasks versus clinical tasks. And I do believe that the administrative can help the clinicians be more effective with their clinical decisions. So I see them very related. And perhaps on the front end, it's the administrative to bring it back to the care team. But I think that setting up the clinical decision support for the experts, I think is so important.
Yes. And I would also differentiate even like putting on a grid of on the clinical side, putting it as complex versus simple tasks. And you still there are tasks or interactions that require much more empathy. And then you don't want to have a bot do that or perform those interactions that require empathy or a bit more complex. 80%, 70% can be done by bots probably or by agents. But you need to plot on some kind of a diagram of volume versus complexity or empathy, all of those touch points and say, okay, you know what? Let's keep those touch points for the humans, and the rest can be done by the agents, by the AI agents. And that's how we typically are working with our clients on mapping those use cases.
When you talk about mapping that, the other interesting thing I was thinking about listening to you is around what time of day is it?
Yes.
Because I know that there are certain important decisions where that clinical touch is essential, but giving the patient something in the meantime to make them feel like they're moving towards some answers, I think is important as well. So I think about the time element as well for that.
Absolutely. Yeah, and AI doesn't sleep. Okay, so AI can work 24/7, and they can provide a lot of guidance and information there, even if it's supporting, if it's just to support both on the clinical, some basic answers, but much more on the administrative side. Um, when we look at the future now, let's say 3 years out, 5 years out, I don't think we can look much more than that. How do you envision the future of AI, of the combination of AI and patient experience in the next years to come?
I would say there's certain directions that we're going in as an industry. One is around proactive care. When the patient is on medication, for example, why can't the bot reach out proactively and find out about side effects? These are the things that you can expect. So, are you experiencing any of these? So, I think the proactivity is an important future part. I only see it sometimes. There's a huge opportunity on that one. I would say the second thing is holistic. There are many things, many body parts, many doctors that I have. And so if AI can help me understand, I might be taking medication for one health issue, but it might be impacting another. So I think AI needs to help me understand what my symptoms are, for example, and how that is tracked to other things that are happening about me. It's just not done. It's disconnected. I would also say that a lot of times I see AI focused on an interaction, a particular care format, like in person or virtual. And as I mentioned, data is separated. So I see another thing of looking at the patient across all their touch points. I think that's very important. And then finally, I think that very, very important thing around AI is around personalization. And so I think that's very important that it interacts with me for my personal needs, my profile, my history. I just saw a very interesting oncology platform announced that they have a purpose built AI assistant in their app. And what I really like about it is that the AI knows what cancer type the patient has, where they are on their cancer journey, and what are the next couple steps in care. So it's only in beta right now, but for me, directionally, of being able to know me instead of addressing each touch point as a who are you? I think it's so important to be able to take me down my own journey. And I love that whole personal response. It knows me
Yeah.
because it's talking about and sharing information about my type of cancer, for example.
And you mentioned
A
before that
personalization.
unique health journeys, and I think that's you touched the point there. With in the future, you will have almost like a personal assistant, a personal healthcare assistant that will know you, all of your history, let's say historic blood test and lab test and illnesses, and looking at symptoms that you have today, and can even guide you on a very personal, unique patient journey. And I love that what you talked about proactive care, and I would also add to that preventative care. And I think prevention is very important in healthcare. We all know that, with the colonoscopies and the breast cancer screening and so on. And if we can utilize it more to prevent illnesses before they're happening, and give it also to underserved populations, which can we know from early indicators to help people in underserved populations, or even everybody, that should come to fruition probably in the next couple of years in different types of screenings and so on.
One of the things I mentioned about the personalized that's so important, I just did lab work and my cholesterol was elevated. But the reason why it's so important that ChatGPT looked at the other tests that I did across the doctors, my risk factors were very low in other areas. So I'm immediately thinking, okay, they're going to put me on medication, and it wasn't the fact at all when you take all the pieces together from what I had done with my lab work. So that personalization, I think, is so important for patients.
Absolutely. Absolutely. And so to summarize, as the last question, when you're looking at the different aspects of healthcare, the healthcare industry, the rise of technology, how do you see companies like Zappix complementing all of these changes and being part of that?
So I actually remember seeing a presentation that you did at a local event. And you showed, for example, and this will help you understand how I'm thinking about this, the Zappix platform and using AI-driven support for patients across a journey. I think it was a surgery. And one of the things that I really valued was the instructions before a surgery as the pre, and the during. I love during information supports what's going on, but the afterwards is around recovery. And so I really think that that's important about how AI can support the patient continuously because it can lead to the best outcomes. Another thing I think about with where things are going and the platform that you have is the electronic outreach.
Yes.
I've mentioned before that staying connected to the patient is so important. And when you do, whether you call them surveys or whatever, the touches that are done, you're bringing back information that the care team can act on. So I think that not only support them through their journey, but also being able to see what's happening with the patient between appointments or after their hospital activities. Beyond the walls of the hospital. I think it's so important. And then the last thing I would say is I think that AI driven reporting and insights are key. If if you have a care team and they understand what they could have done better from a workflow perspective, or they understand how to better engage patients based on what they see, I think those actionable insights are important because it actually pulls together the different interactions and it gives them visibility into improvements that they can make in their own health workflows and practices. So I think that it's not just the guiding of the interactions with the patients, it's also what does the information say about what the interactions have been that could really help improve healthcare.
Absolutely. And we are, Zappix is all about proactive engagement. And I really believe in engaging with patients throughout the patient journey, pre, during, post. And that's part of the reason we have invested a lot in the intelligent outreach, to reach out to the patients at their preferred method, at the times of their preference, language of preference. All of that personalized journey is critical. I want to thank you, Sherri. It was a great conversation and very insightful. And thank you so much.
Thanks for having me.